my name's Hannah. We're going to be your nurses for today. Can you give me your name and date of birth?
Raj Tog, 5/12, 1956.
And then who do you have here with you?
I'm Suni, I'm her daughter.
Okay, so we're just going to educate you on some peritoneal dialysis. I know you got your catheter in 4 days ago, but beforehand I wanted to ask how you're feeling.
I just feel a little uncomfortable. I feel like maybe it would be better to have a shaman in here after the whole process. It would be a good support.
Okay, yeah, we can definitely bring one in here for you. Before that, do you have any other cultural practices? I noticed you're not making eye contact or anything.
Yeah, it's just something that my family doesn't really do. It's just out of respect.
Okay, good to know. Well, I'll go grab the shaman and be right back, okay?
And is now a good time to kind of go over home care?
I suppose.
Alrighty, so here's the shaman.
Hi, Paj.
Hi.
I'm your shaman. How are you doing today?
Okay, I'm just a little uncomfortable ever since I had my surgery. It feels like part of my soul is still in the operating room.
Okay, so this feeling is totally normal, and I want to reassure you that you are not alone in this process. I honor your strength and your resilience through this all. Your identity is not your illness, and you are still whole. Would you like me to perform a small ritual around your care for your silver treatment?
Yeah, that's okay. I know the nurses were gonna go over a couple of things here first, and then I can do that afterwards.
Okay, sure, we can do that when the time is right. Do you want me to stay during your nurse's education?
Yes, please.
Okay.
Alrighty, so we have a packet here, kind of just explaining peritoneal dialysis. Are you ready if we go through this?
That's okay.
Okay. So first off, dialysis removes like waste and extra fluid, so that it don't build up in your body and helps maintain your blood pressure when your kidneys aren't able to do it themselves. This is another way that can help with that. So I know you mentioned that you're going to kind of do the automated peritoneal dialysis. So this is through a machine while you sleep, and then depending on your remaining kidney function, you can also do it throughout the day, but I know for right now you're going to do it during the night. And you had your procedure done with this small tube, soft tube that's inserted into your abdomen. And so the process is done. 2 to 3 quarts of special cleansing fluid or dialysate flow through the catheter into your abdominal cavity, and it takes about 10 minutes for the fluid to fill your belly, and then the fluid stays in there for about 8 to 10 hours, which is why it's done when you're sleeping. And then this is also known as the dwell time. The dwell time depends on your body size and how much waste needs to be removed. And then during the dwell time, the waste and fluid passes through the inside lining of your abdomen into the dialysate. And this lining acts as a filter and prevents other important blood products from being wasted also. And then after a few hours, the dialysate will be drained into a waste bag, and then you can empty it from there. And then, like I said, this machine will kind of do this exchange for you. So the machine will be programmed, and that's kind of how that process will go throughout that.
And before we continue, what questions do you have about this process?
So far I'm okay. I think I understand everything.
Okay, great. If you do have any questions, just let us know. I'm going to go over some care tips and infection control. So something we want to watch for is peritonitis, which is infection of that abdominal lining. And you will notice this with if you have any extra abdominal pain, redness, warmth around your catheter site. And to prevent this, we recommend washing your hands really well before and after catheter care with antibacterial soap, and trying to only touch the supplies for the peritoneal dialysis. And then doing the exchanges in a clean area kind of by yourself, and wearing a surgical mask while you do the exchanges. Some other care that you should be aware of is wearing loose-fitting clothing, especially around the site. You want to tape the catheter to your skin to prevent any accidental pulling, and then cleaning the catheter site at least once a day And you want to look at that fluid, and if you're noticing that it's cloudy and not that kind of clear yellowish color, that's something to report.
Alright, and then another important thing to do when you have part of the dialysis is daily weights, because increased weight can mean you have fluid overload, and then decreased weight can indicate dehydration. So we kind of want it on that middle area to make sure that the dialysis is working correctly, and then just make sure to watch the catheter site for redness, swelling, and pain, which can be a sign of infection. And then the dialysis fluid, that is clear, pale yellow, not cloudy, because cloudy can also indicate an infection and things like that. So that's kind of just the basis of the process and things to look out for. Do either of you have any further questions for us nurses?
Yeah, so I'll be taking care of my mom and helping her cook while she's recovering, and I've just been noticing that they just bring very bland foods to her while she was here at the hospital. I'm thinking that she needs some more of our traditional dishes that will bring her strength back. I'm wondering if that's okay for me to bring for her.
Yeah, so with dialysis, we usually try to focus on a more low sodium diet with the kidneys not being able to kind of filter themselves. So I know with Hmong culture, you guys tend to use soy sauce. I don't know if you guys do or not, but that's kind of high in sodium, so more low sodium soy sauce, or like flavoring your foods with herbs such as garlic can be beneficial alternatives when you're able to. And then high protein is also beneficial. So if you guys like pho, a great source of protein in that can be chicken, fish, and tofu. Just making sure to limit like amounts of broth-based soups, and like tracking fluid intake is beneficial with those foods.
Okay, so that means that she can't have any of her traditional dishes anymore because of her dialysis?
We still want you to make sure that you can incorporate your cultural beliefs and traditions, because we don't want to take that away from you. So if you are having foods like that, high in sodium and things like that, a beneficial thing can be in taking fluid, high amounts of fluid, to kind of flush that out, so that way you can still take in those cultural practices and keep that as part of your lifestyle, as what brings you happiness and things like that. We definitely don't want to take that away.
The only thing about the fluid intake is that you want to be tracking your inputs and outputs. So if you are taking in more fluid, just tracking that. And we also recommend a low potassium diet, because that can also be something that can be kind of bad for the dialysis.
Alrighty, so I think that's it. Do either of you have any further questions?
What if I need some help at home and I don't know what to do? Is there any way to work around that at all?
So in this packet here, we're going to send you home with this. It kind of just outlines the procedure and things to look out for. In the back are different resources and home health care and things like that. So if it ever begins to be too much, or your daughter isn't able to help you throughout that process, you can always refer to those.
Okay. I also put my phone number in there if you ever need to contact me.
So we'll send this home with you. Alrighty. And we're always here to help you if you have any further questions.